Hey guys, my name is Terveer. I'm a nurse practitioner at MidAmerica Medical Spa in Glen, Illinois, and I wanted to talk about fillers. So right off the bat, I'm going to break that preconceived notion that all fillers are bad, because that is just not the case. Really, the best injectable is not detectable. If you can tell you have fillers, it's probably because of one of three things. Either too much was used, the wrong product was used, or it was just bad placement of filler. So ultimately, at the end of the day, you should not be able to tell that filler has been done. I personally have multiple syringes of filler in my face. If I had to guess, after all said and done, I probably have remaining at least about 5 to 7 syringes of filler in my face. I don't know if you guys maybe disagree with me, but I feel like I don't really look like a fake, overdone, overfilled, puffy filler patient. So, a lot of that comes from not only having great injectors that I use to inject myself, but also I have a lot of different fillers in our portfolio. And so we really like to pick the right type of filler. And so just to kind of branch into what I want to talk about next is types of fillers. I'm going to go over my entire portfolio that we have here at MidAmerica. So starting off strong, the OG Restylane, typically used for under eyes, can sometimes be used for the border of the lip. It's a great product, very low water affinity. It's very little hydrophilicity, so not going to pull a lot of water. It looks beautiful, great for definition and under eyes. Insider secret, Restylane Eye Light, exactly the same thing as the OG Restylane, just packaged a little bit differently, specifically for use on the under eyes, but it's just coming in half syringe increments. Next up, Restylane Refine, nice, thin, stretchy, mobile filler. Integrates with the tissue, does great in smile lines, great for just a little hydration to the lip, but minimal volume. Next up, Define, so exactly the same kind of explanation as the Refine, but just thicker. So a little bit of a juicier lip. If we want to hit that area, we can hit those smile lines, what's considered the marionette, kind of that downturn that you get in the corner of your mouth, but just if it's more of a severe case. My favorite, Restylane Kiss. So 99% of the time, unless you have a strong preference for something different, this is what I'm using in the lips. I can also use it in the perioral lines, those little smoker lines, even though the most people that have them are not smokers, that happen on that upper lip, below the lip. Some smile lines, again, just kind of superficial etching out. Love this product. Its competitor, second most used in the lips, is the Juvederm Ultra. I always tell people Juvederm Juicy, so if you are wanting a little bit of a juicier, poutier lip, this is typically what I'm reaching for that. Still very natural, but just a little bit plumper and poutier. Restylane Lift, another OG, one of my favorites, great for bony support. So hitting kind of the cheek area, the jawline, the chin, great products for that. And then Restylane Contour, one of the newer ones. So this is great for cheeks. If you need a little bit less of that bony support, but a little bit more rounded look. So if you are already very thin, very gaunt, and you just need a nice soft cheek enhancement, this is fabulous for that. Next, we have Radiesse. So this is a little bit different. This is a biostimulator and a filler in one. It has a gel carrier, but it also has the ability to stimulate collagen and elastin. We can use it in its regular, undiluted, unreconstituted form as a filler for very similar to how we use Lift, hitting that kind of bony cheek support, that jawline, sometimes coming in and etching you out, making you more defined through here. We can also reconstitute it. It's called prehydrated or hyperdilute, and we can use it as a biostimulator, hitting the neck, the back of the hands, the décolleté, the face, for any of those kind of crepier, kind of thinner skin looks. Or if you are on a GLP-1 weight loss medication, we can use it to kind of revolumize some of those gaunt areas below, through here. And then last but not least, where's she at? Here we are. Sculptra, another personal favorite. So this is very similar to Radiesse, but it doesn't have that gel carrier component. It is just strictly the biostimulator aspect. So again, using it to stimulate collagen, face, temples is a big one. The temples can definitely make the face look significantly older. Just a little bit of enhancement there. We're going to take 5 to 10 years off your face without even trying. We can use it around kind of that submalar, preauricular area to kind of help tack you back and lift you up a little bit. Also in the neck, we also use this in the butt, a little bit of liquid BBL, so we can give you a little bit of some lift and definition to the butt. So that is our filler and biostimulator kind of volumizing portfolio. If you ever have questions, definitely reach out to me and let me know. I'm always going to do a very thorough in-depth consultation to determine what your goals are, and then from there choose the appropriate filler and the appropriate mount for you.